Today I'm going to show you how to use a wheel filter. So a wheel filter is a piece of harm reduction equipment that you can recommend to clients who are injecting drug users. Wheel filters are designed to filter out any impurities or bacteria from things like prescription pills and other illicit substances. Filtering is really important because impurities and bacteria can cause damage to veins and organs, as well as cause infection. There are 3 types of wheel filters available at most Queensland needle and syringe programs. Let's take a look at each one. The 5.0 micron filter is the largest wheel filter and intended to get rid of things like chalk from prescription tablets like benzodiazepines or dexamphetamines, and even recreational drugs like ecstasy. After filtering with the 5.0 filter, you can proceed to using a smaller wheel filter. The 0.8 micron filter is suitable for most substances, including morphine sulfate tablets and other opioid-type medications, such as buprenorphine. The 0.2 micron filter is the smallest wheel filter. This filter is best used for drugs such as crystal methamphetamine, methadone, and cocaine. It should also be used for any substance that may have been in someone's mouth. Remember, this is only a guide, as some tablets don't crush easily or dissolve in water. So talk to your local needle and syringe program for more information. Let's have a look at a wheel filter demo. Start by making sure the surface you are using is clean and you have washed your hands thoroughly. Clean your spoon and any other injecting equipment you may be using, including tourniquets. Priming makes it easier for the drug to go through the wheel filter. To do this, draw up 2 ml of sterile water into a 3 ml syringe. Attach your wheel filter to the syringe, making sure it's screwed on tight. You can push the water into the crushed up mix if you like. Set your primed wheel filter aside, but keep it in the packet to avoid contamination. Add extra sterile water. If you don't have any sterile water, you can use water that has been boiled and left to cool. It's really important you only use cold water in your mix, as hot water will cause the binding agents in your pill to react and clog up your wheel filter. One way of stirring the mix is using the plunger of your syringe. Allow extra time to let the mix dissolve. Take a cigarette filter and drop it into the mix. This will help filter out any large particles before using your wheel filter. Some clients will tear up the cigarette filter. However, we suggest not to do this, as ripping up the filter can sometimes lead to fibres getting caught up in your mix. Using your 3 ml syringe without a tip, draw the mix up into the syringe. Attach your primed wheel filter, screwing it on tightly. Attach a large gauge needle and again check it's screwed on tightly. Get a new 3 ml barrel syringe, but leave it in its open packet until you need it. It's important to leave your equipment in the packaging as long as possible to avoid any contamination. Insert the large gauge needle with your mix through the tip of the new barrel. Slowly push the mix into the new barrel, making sure you do this on a slight angle. This will allow air to escape and prevent any pressure buildup. As you can see, the wheel filter has caught all the unwanted binders and fillers, and in the new syringe, all we are left with is the active drug. With your filtered mix in your new barrel, attach a small needle for injecting and follow your safe injecting practices. Make sure you safely dispose of your injecting equipment, and remember that wheel filters are designed for one use only. Thanks for watching this demonstration on how to use a wheel filter. If you'd like more information, you can contact your nearest needle and syringe program or us here at Dovetail. Bye for now.